Hey everyone, we're so happy you found us. Welcome to the very first episode of Why Should I Trust You? Where every week we're going to dive into why so many people around the country right now say they mistrust science, public health, even medicine itself. And we ask, is there a way to build back from all this? We're your hosts. I'm Brinda Adhikari. He's Tom Johnson. She's Dr. Maggie Bartlett. You're going to meet them in a second. Let's get started. Guys, we're here. We're doing this.
We are here.
Who are we?
First of all, I can't believe we have a teleprompter or that you ordered these mugs.
Yeah. I know. Merch, everyone. We're doing merch. We got the merch. I'm not entirely sure that we can keep doing the merch, but right now we got the merch. Well, listen, it's so good to finally be here. We've been talking about doing this for a while. I think the first thing we got to tell people is, who are we? Why are we here?
Yeah. Network news veteran, gone on to do other things. You worked with Jon Stewart.
That's right.
I was a showrunner at the circus. And Maggie is a virologist.
See, I'm doing terrible already off the bat.
No, you're doing great.
Yes, I'm a virologist. This is not my typical way of presenting.
Yeah. But talk about how you had the idea for this and you reached out to Melinda.
Yeah, so about a year ago, I was really concerned with H5N1. I had seen it start to pick up in different places, and it was the same sort of ingredients we had for SARS-CoV-2, except here in the US. And we weren't doing what I thought we would do, lessons learned after the pandemic. One of these sleepless nights, I was watching TV, Jon Stewart's show, and
oh my goodness.
I had seen Brinda on the show, and she was talking about how they break down messages to get through to the public. And during all of his shows that I've seen over the years, he always thanks his producers. And it kind of hit me that, you know, if I want to tell this story to the public and really change the conversation, I need somebody like Brinda to help me do that. And kind of on a shot into the dark, I sent her a message on LinkedIn, and to my surprise, she responded.
That's right. I was on LinkedIn.
Yeah, she was on LinkedIn.
No, it was great. I mean, when I got the message, like, you're absolutely right. I think it was a surprise. At first, I was like, why is this virologist reaching out to a TV news producer who just wrapped a news comedy show? And, you know, you were asking about just messaging around bird flu and Mpox. And I was just thinking to myself, I was like, what can I even offer this? But the more we started talking, the more it just became clear to me that clearly you were seeing that the reason there was even a necessity for doing this was because there appeared to be a lack of trust from the public to what you were saying. At least that was what you were hearing. I don't want to put words in your mouth, but that was...
No, absolutely. That's what, it came as, why isn't the public aware of H5N1? And then as I started to realize that I was in my own echo chamber as a scientist, like, we're concerned about this, and why isn't the public? And then we started talking about more of these studies about trust in public health and vaccination rates and things like that all are emblematic of what we all went through during the pandemic, but that we kind of have to set right ahead of another threat. And not to scare people, but we have tools, technology, and expertise that we didn't have at the outset of the last pandemic that we could put in place to make things better.
Yeah. No, I think that's super interesting. And really, the first thing that I did was, first I thought about, like, okay, what can I really offer this? And the next thing that, as we were looking into this, we were like, look, if trust is a real issue, I called up my buddy Tom Johnson. He and I worked together for a million years ago at ABC News, World News Tonight, right? Shout out World News Tonight. And Tom, we just started digging into this. Yeah. And what we really, I think the first question I imagine, if I'm a listener or a viewer, is there a problem with trust in science, public health? How do we even know that?
Yeah, and I think we were stunned when we started looking into it. It seemed like we're 5 years out from the beginning of the pandemic and things were receding and there was a lot of anger. But to say it's a backlash, I think is just understating it. It's profoundly, I think, changing the way Americans are viewing public health especially, but even their own relationships with doctors, and even their sort of perception of science. So
right.
That, I think, was the big center. Just truth be told, we were thinking this could be a doc series. Right. Then the election happens, and we're thinking, this subject is now front and center.
I know. We were like, there's no
Yeah,
way
there's
we're
no
going
way
to
we
take
can wait a
18
year
months.
to try and sell a doc
That's right.
series that no one's going to buy.
Yeah.
So we're thinking, how do we rush this out now to kind of get into this topic? And that's the podcast.
Yeah. One of the things I remember us thinking about was like, how do we actually make the case that there even is a problem with mistrust for science and public health? And there were a few different kind of things, pieces of evidence that we looked at.
Yeah.
You know, one was just looking at just studies that straight up asked about trust, right? And Tom, you looked into this.
Yeah. And I put these in a document because you called me yesterday and said, get those numbers.
That's right. Need them in a Google Drive.
We like this one. This one's from Pew. In 2019, this was right before the pandemic.
Right.
86% of Americans said they either had a great deal or a fair amount of confidence in scientists to act in the public's best interest. So 86% of Americans said, yeah, I think scientists act in our interest. Today, that number's down to 76%.
Oof.
So
Okay.
just to underline that, that's a quarter of Americans, a quarter of all Americans don't think that scientists act in the public's interest.
Right.
That's a pretty profound thing. That's not, the lockdowns were messed up, the school closures was fucked up, the masks were a mess. This is, I don't trust scientists to have my back. So I think there's a lot to unpack in that one.
Right.
The other one was feelings about doctors and hospitals. So trust in physicians, trust in hospitals dropped from 71% in the earliest days of the pandemic. That was April of 2020. And it's down to just 40% today.
Holy crap.
Yeah, so 40% of Americans trust
That's a
physicians and
30%,
hospitals.
30-point drop.
Yeah,
Right?
that's
Scientist,
pretty...
math Maggie?
Yes,
I got that right?
You did. It's a really scary drop. And I think for me as a virologist and as a scientist, it's also very, just harrowing to think that people don't trust scientists to do things in the effort for public health, because ultimately that's what it's all about. Any of the things we're working at in the lab are meant to help people.
Right.
Yeah.
Well, let me take us one step back, because look, the truth is I look at these studies and, certainly, seeing the headline that a quarter of Americans do not trust that scientists are acting in the public's best interest, it seems scary. But then I put myself in the shoes of somebody facing a survey like that.
Yeah.
And I'm trying to sort of understand, like, if I were asked that question, what do I even kind of think the word scientist means? There's something about this. And Tom, you and I have spoken about this, which is like, there's something a little bit unsatisfying about a study that says, well, what do you think about science? Or what do you think about physicians?
Yeah, you don't
I'm
really
like,
know how people are hearing the question.
that's
Like,
right.
am I thinking of a scientist, trying to cure a disease, or am I thinking of a scientist that works for a pharmaceutical company? What am I thinking about?
Right.
Also, just doctors. Like, how do I feel about? Are you asking about my doctor? Do I think about doctors in general? The
Yeah,
whole
there's
industry
something.
of medicine. It's just, it's sort of it's unsatisfying
Mm.
to get at sort of what actually is happening, and that's
Right.
why I think like actions are
Behaviors.
are another way to track this.
Yeah.
I know you've looked at some of that, and I know you focus on that.
Yeah,
well.
absolutely. I think one of the things, data is the cornerstone to all of science, but the actions that people take because of their feelings about something in public health is what really matters at the end of the day. So as a virologist, I want to know everything about what the public is thinking, but I really want to know, what are they doing?
Right.
And that comes down to, vaccination rates. It comes down to hand hygiene and practices like wearing masks. But when we look at things like childhood vaccinations, which have really taken a hit from this, data from the CDC, basically the number of kindergartners who've been vaccinated for the typical slate of required vaccines is now down from 95% to 93%. And now that doesn't sound like...
I know. I'm like, a 93% is still an A in my spelling test.
Yeah.
So why is that? Why is a drop from 95 to, and I think I saw it might be even below 93% now. Why does that worry you?
So below 93%, and this is particularly important virus by virus. So your routine vaccinations include measles. And now measles, you need a high, basically above 95% of the people to be vaccinated to protect from new cases. When you drop into 93, you're going to start to see outbreaks. And because measles is one of the most contagious viruses there is, it's literally the most contagious one that we've studied to date. When you drop below that 93%, you're basically just like cracking the door open for outbreaks and then potentially pandemics of something that we've had a solid approach for
That's
decades.
right. And I just want to add that it looks like if you look at CDC data that last year, what was last year? 2024. This whole 2025 thing is very new to me, y'all. 2024, I'm going to take it one step back. I'm going to say this over again. In 2023, there were 4 outbreaks of measles. Last year, there were 16. So 2023, there were 4 outbreaks. Last year, there were 16.
Yeah, and there's, just to remind everybody how this works, that when you enroll your kids in the public school, state by state, there are requirements for what, vaccines you have to have to enter the public school. The thought being that everybody's entitled to a safe education. There's a lot of movement across the country, state by state, to loosen those restrictions. And that's something we're seeing an uptick post-pandemic, that groups are fighting to loosen the restrictions on getting vaccinated. And I think that's where you're starting to see that number inch down.
Yeah, and I think it's sort of, I know we're harping a lot on the vaccination piece of it, and part of that is because it is such like a behavior. It's like a way, it's one thing for someone to say they don't trust science. It's another thing for them to, maybe take that action a step further. One of the things I know I also saw was something like, we have, it's like 40% of people think that parents should vaccinate their kids with like the childhood vaccination schedule, but that's down from 64% in 2001.
Exactly.
So look, these are a lot of numbers that we're throwing out there, and I know, I think they're interesting. I think it's interesting to note like their behavior changes, but there's one other thing that that for us, I think, which is kind of why we're here. The thing that really, for me, sealed the deal was when we started talking to people. We just really started talking to real people about their stories of kind of how we got to this place where, it's one thing to answer a pollster, a Gallup pollster, a Pew pollster, census survey. It's one thing when you are, following, perhaps you're in a state where they're seeking vaccine exemptions, you're not vaccinating your kids. That says something. Okay, I now feel like that's a little, but then it got right down to, we started actually just calling people up and talking to them. And I think that's what I'm really excited about. That's one thing we're really trying to do on the show, as we continue, as we keep going, is actually speak with people who either somehow feel abandoned by the public health establishment. I've heard it referred to as that, the public health establishment, who aren't trusting mainstream science. We're working with a couple of organizations, really excited to talk to you more about that. There's a group called Braver Angels, fantastic organization. They work to bring folks from red states and blue states together to have difficult conversations. But really what we started doing was we just started kind of looking, kind of trolling the internet for stories about people who were perhaps not kind of feeling really on the same page with the scientific community. And one of the people that I came across was a woman named Melinda Hicks. And I came across her name in an article that I read, I think it was the New York Times.
Yeah.
And it was an article about Democrats who voted for Donald Trump. And she was just a kind of a passing reference in the article. It wasn't like it was a deep dive. It was about several people who had voted for Donald Trump who were once Democrats. But I decided to call up Melinda because I wanted to see what kind of led her to do that. And I got to go back and look in the article. There may have been something in there about health, but I wanted to see if there was something about health, and public health in particular, that may have driven her to that change. It was really fun to talk to her. I really like her. And I wanted to introduce you guys to her. So let's meet Melinda. Okay, we are joined now by Melinda Hicks. Hi, Melinda.
Hi, everyone.
Nice to see you. How's the weather there today? It is freezing in New York City. I'm going to tell you that right now.
It's a bit cold here too in Atlanta.
That's right.
And we'll take it a little
Yeah,
bit, you know.
yeah, for sure. Hey, Melinda, I just wanted to go through a few things real quick and make sure that like I have your backstory right. So you are a TV writer and producer.
Hmm.
You're just like us.
Yes.
You're a TV writer and producer. You're living in suburban Atlanta.
Hmm.
You're a mom.
Yep.
And you were a lifelong Democrat who voted for Donald Trump this time around, right?
I sure did.
Okay.
Surprised even myself.
Well, listen, I want to, my first question is, it seems to me that like there was like the before times Melinda and there's the now Melinda. Is that feel right to you that like there was kind of a journey that you took to get to the place you're at right now? And I was wondering, and you and I chatted on the phone about this, but I was wondering if you could share a little bit about that and maybe even why don't we start with what led you to vote for Donald Trump in this election?
Yeah. So yeah, it's definitely been a journey, but it's been really a journey about health and my, kind of moving more toward natural things, even way before that. And in terms of Trump, it was Kennedy. It was Kennedy. I mean, I've been a follower of Kennedy for 30 years. Am an environmentalist. And I followed his work there. Then I followed his work with health and, all the things he was doing with children's health. And so, when I was even a volunteer for his campaign for over a year. And when he made that announcement, a lot of us, obviously all of his followers and all of his volunteers, became very close. It was an incredible mix of Democrats, independents, people who hadn't even voted in the last election, libertarians, Republicans. So we all took a little breath and said, okay, this is where it's going. But I knew I would vote to get him in because I think it's that important. I think health is the most important thing to us. And I just, it took me a bit to really come to that absolute decision. But, I always remember something that somebody said, and it was, a man with good health wishes for 1,000 things. A man with ill health wishes for one. And so, I want this country, I want our children, I want myself and my family to be healthier.
Yeah.
And I feel like it's been an uphill battle. I feel like I've been, turning products over and looking at ingredients. And, I feel sometimes like I'm working, like our government agencies are working against us. They're allowing things in our food, in our air, in our water, in our soils that are making us unhealthy. And we have to fight against it by knowing these things. And a lot of people don't know these things. And that makes me really sad because we have so much ill health. And I don't think we're supposed to be going through life sick.
Right.
I just don't.
Let me take you back a little further. So something that really struck me in our conversation was you talking about there were two kind of seminal events that happened in your own life having to do with health that it seems to me really impacted you. One was your father's diagnosis and journey with cancer, and then your own diagnosis of a chronic condition. Tell us about those two things.
Yeah, so I was about, I guess, I was 20 or 21 when my dad was diagnosed with cancer. We don't have a history of cancer in our family. This is a robust, immigrant Italian man. He was out in the sun, definitely got his vitamin D. We lived down in South Florida. He was very active. He ate well. My God, my dad ate so well. Grew some of his own vegetables. So for him to get that cancer diagnosis was like, a shock, obviously, to all of us. I think he was only 65 at the time. He had just retired from, a lifetime of just working his tail off for his family. And it was really heartbreaking. And what I saw was that, first it was surgery to take out the cancer, and then they hit him with chemo, and they hit him with radiation. And it wasn't long before, maybe a year or so, before the cancer was back. And it came back twice. And at the end of the day, they just kept hitting him with chemo and chemo. And I can't remember whether the second cancer was more radiation, but it just, at the end, his organs were failing. And his organs were failing from the treatments. He ended up on dialysis. So what I saw was that he was diagnosed, he was hit with a lot of toxic things. But what nobody ever talked to him about was, what the state of his body was. What about his microbiome in his gut? What about toxicity? My dad was a carpenter. He created custom furniture for yachts. I mean, there were yachts like Evel Knievel was one of their customers. It's crazy. Barbara Mandrell was one of their customers, and he was an artist. But that meant that he was around a lot of chemicals, a lot of toxins. And nobody talked to him about his diet. What was he putting in his diet? And, having come from Italy, my dad loved, obviously, Italian deli meats. Every day at 5 or 5:30 a.m. when he was getting ready to go to work, there he'd be making his sandwich. My parents didn't know anything about organic, none of those things. And in Italy, maybe eating, things like prosciutto and, the other Italian deli meats, wouldn't have been a big deal. But here in this country, there were a lot of nitrates in that. I know that nitrates have been implicated with colon cancer. There's a connection there. And so, I just felt like nobody really gave him, they really didn't talk about anything other than, here's the toxic stuff we're going to use to try to cure your cancer. And I saw him go from being this robust man to just, on his deathbed. And it sucked. It sucked. And I felt like nobody really talks about that stuff. And now, my journey has been to talk about and to look at, what toxins we're putting in our body. I'm careful about, ingredients in our food and all those things. And I feel like, where is that element to care? Where is that element to prevention? Maybe if he had somebody talking to him about those things, maybe he could have prevented the second cancer. Maybe it could have prevented, the third. And then for me, not long after my dad died, I developed psoriasis on my scalp. Didn't know what it was. Went to a dermatologist. Here's this red, itchy, flaking, awful thing that I'm having to deal with. And he comes in and he takes a look at it and he goes, it's psoriasis. And I said, okay, how do I fix it? And he goes, you don't. You just have to treat it. There's no way to fix it. It's incurable. And he was out of that door within minutes and just handed me a bunch of sample steroidal creams, and said, try some of these and see which one works. And I thought, oh my God, like, I've just been told that this awful thing that is happening to me is incurable. I've been told in the most brusque way possible with zero empathy, and then handed a bunch of creams. And I went home and I thought, I really don't want to put steroids next to my brain. Something about that doesn't seem right. But I went ahead and tried one of them because I thought, I've got to get this under control. I don't know what else to do. So I did. I tried one of them. And a couple days, it literally was about 2 days, I woke up and it felt like somebody had smacked me in the back of the head with a 2x4. My skull, everything just hurt so badly. And I thought, oh no. This is not the way I'm going to be treating this. This is not okay, and it's not healthy. And so I went looking. I ended up at a natural doctor. He tried some herbs. He tried acupuncture. Nothing really seemed to work. And then one day I was in his office and he said, there's this Chinese herbalist over on Buford Highway. That's like an area that has like a lot of, Asian doctors, Asian, food, just one of those areas. And I was like, hey, I'll try anything. And I went in there and she barely spoke English. And I remember she took my pulse, she looked at my tongue, she looked at the rash, and she gave me some herbal pills. And then she had these women behind the counter, and they had these It looked like the library card files, where they just had like herbs in every little bin, and they pulled it out and they made me this little concoction, and I went away with this couple brown bags of this stuff that looked like it came off the forest floor, and I was told to boil that and pour it over my head, which I did. 98% better within about 2 weeks, and it stayed that way for a very, very long time.
Huh.
And I thought, wow. And it cost me all of about $15. So, it's kind of, it's interesting, to go from what I went through and being told incurable to then going and having, somebody who, is from another country using herbs, not steroidal creams, not anything, out of a, pharmaceutical, regimen, anything like that. And it was 98% better.
Right.
So.
Wow. There's, do either of you want to ask
Yeah.
for anything from that?
First of all, thank you for sharing that story. It's
Yeah.
deeply personal. I think some of us at this table have had parents who've died of cancer. Was your father, was it late stage colon cancer? Was that?
It actually wasn't. I don't remember the details. I was about 20 years old at the time. I
Sure.
was in college. The thing I remember was the phone call from my mom.
Yeah.
Sorry. So no, it wasn't. It wasn't late stage. No, I think that they caught it rather early. What I wonder is that did he need the chemo and the radiation? Because a cousin on my mother's side, completely obviously unrelated, ended up also with colon cancer, ironically, after my dad had passed. I believe it was after my dad had passed. And they just did surgery, took it out, said they had all the margins were clean, and he went on his way, and he lived almost another 15 years into his 90s. And I remember thinking, that's interesting. Why didn't he need chemo and radiation? Why didn't they hit him with that? And I just wonder if, obviously, everything is, I know you have protocols and of how to treat things, but are some people or some doctors more aggressive than others? If maybe they had been less aggressive, is it possible they could have just taken it out and maybe he would have lived? I don't know.
Yeah. Did these two experiences change the way that you think about medicine for yourself? You've sort of told us the story, and I'm just wondering where this led you.
Yeah, well, it led me into looking at more natural things. I looked at health in a way of how do I prevent sickness rather than how do I get sickness and then go off and find people to help treat me. And that, led me to eating cleaner food. My husband and I made a lot of mistakes when we were getting into the whole natural thing. We thought, natural potato chips are good for you and natural cookies are good for you, and then you do really stupid things and then you go, okay, well, yeah, that's still bad for you, even if it doesn't have, high fructose corn syrup in it or, bad oils or, bad chemicals in it. So, it's a journey, and then you realize, okay, I need to be eating whole foods. And so it really drove me to looking for just more natural healing, and kind of drove me away from, the pharmacological, model of healing.
I wonder, if some people listening might be thinking, you were faced with two potentially incurable, at least one of them is incurable, your autoimmune disease. Your father's cancer often can be incurable. Is it possible that some of your anger towards what went down here really is about your anger towards these diseases, but that you're directing it to the medical community and to these traditional treatments that save a lot of lives, and in really tough situations can extend life. I mean, do you think there's a possibility? Have you thought about that?
I don't know that it's. I mean, it certainly didn't start off as, anger. It was really more disappointment. You know, it took me a while to, and obviously, and grief too. I mean, being told by that dermatologist and being treated that way. I was grieving. That was really hard to hear. Like to hear. I mean, obviously, that's a, you know, psoriasis is a, real pain, and it's, an awful thing. But that's the least of it. That's not cancer. Or other autoimmune diseases. That's not MS and things like that. So, it was really more disappointment in the medical community, and then just starting to question, really, is this the right way for me to be treated? If there are other things that I can do, to prevent, but then also things like acupuncture, things like homeopathy, things like herbs. I go to a naturopath, and there have been a lot of, things along the way that I've been able to recover from without having to turn to, to pharma or to surgery.
Melinda, I want to fast forward a little bit to the pandemic. One thing that I remember saying to you on the phone that you had told me resonated with you was this idea that COVID kind of radicalized a big part of this country because of the what many people, and perhaps you put yourself in this category, feel like was a response that maybe was overreach or felt somehow like it didn't quite meet whatever needs that you had. But I want you to first just kind of, like, if I say that to you, that, was COVID this sort of radicalizing event in your life? What does that mean to you? And I just want to hear a little bit about kind of mentally what happened to you during COVID that made you mistrust what you were hearing the government and the scientific community say at the time.
Okay, so I believe I actually contracted COVID in January of 2020, before anybody really knew what was going on. It hit me pretty hard. I thought it was a bad flu. And, I ended up with a lingering cough, which I turned to my naturopath, and they sent me some herbs, and I took them, and boom, 2 weeks later, it was completely gone. And then, of course, the news came out about COVID. I mean, initially, I was as concerned as, most people. I didn't initially dismiss it or think it was a conspiracy theory or any of those things. Some of the things that I felt kind of wrong to me, like, I don't know, what was it? What was the whole line, 15 days to stop the spread, or what was the thing that they said? And I thought, that doesn't seem, it's already here. How do you stop this virus? Like, it seemed like some of the things that were being said were more catchy lines than they were really science-based. It's already been here. It's everywhere.
You had mentioned, I'm sorry to interrupt, you had mentioned something about, even hearing about the origins of the virus and the, lab leak theory, wet market, all that. And to this day, that's been something that really stuck with you.
Yeah, I mean, it started in Wuhan. The lab is there. We know that, information came out that they were doing gain of function research. It's like, are we not supposed to come to that conclusion? Or at least, shouldn't we be looking into that more than shutting it down? And I felt like a lot of that in the beginning was shut it down. We don't talk about this. It's definitely it's definitely natural origin, not from the lab. And I have to wonder, I hate to say it, but, I don't want to be a conspiracy theorist, but on the other hand, I think the other side of that coin is sticking your head in the sand. And I don't think that's a safe place to be either, because then you're not being skeptical enough to really try to get to the truth. And now, right, we've had some of our defense agencies came out and said, yeah, there was a certain percentage of, whatever that was likely it was a lab. I forget what's come out and what they've said, but, the people that believed it, I feel like they weren't wrong, because we've heard some information since then that our own government has come out and said, this is X percent likely kind of thing.
Right.
So there were a lot of things that bothered me. I don't think you just have to have eyes to see, like, when they were shutting things down, small businesses were shut down, but we could still go to Walmart and liquor stores. And I remember going to a park. We walk our dogs a lot, going to a park, and they had roped off the park benches. And I'm like, why are we telling people to stay inside? We should be encouraging them. Hey, if you want to distance, fine. Distance yourself from people, but go outside. One of the things that they talked about in the beginning of this, was that people who had low levels of vitamin D had worse outcomes. And I remember thinking to myself, so what are we going to do about that? So we've announced this. This is science, right? This is a scientific study, many studies that seem to say this. They were announcing this on, regular media, everything else. So what are we doing about it? Couldn't we come up with a campaign where we're, giving out vitamins to people? I mean, if we can give free vaccines, why can't we give free vitamins to people?
Well, let me ask you about those vaccines. So for you, these vaccines came out about 11 months after the virus was in our country. On one level, it feels like a miracle to have a vaccine that was able to be rolled out and put in so many people's arms. And, there are scientists and many people, and I think I put myself in this category, Melinda, where, I decided to follow the science and follow the guidelines, because I think in my mind, it felt like, the right thing to do in order to save my life and to protect other people who are immunocompromised near me. But I think for you, it was a little bit of a different experience.
Well, yeah. I'd already had COVID. I think I tested positive, I think, one more time before the vaccine came out. Based on the science that we know from, many, diseases and viruses and things like that. You don't go get a flu shot if you've already had the flu. So I based it on natural immunity. My problem is that all of a sudden natural immunity started getting bashed. They were making it sound as if it's not actually existing, and it does exist. And I wondered why. And I think the reason is because if we talked about people having natural immunity, they wouldn't go get the vaccine. And even, to this day, I know that I've heard some people, I forget who it was, CDC or NIH or who it was, that was talking about, at one point they thought about a more nuanced approach to who should get the vaccines. They worried if they did a more nuanced approach that not enough people would get the vaccine. And I'm like, well, that doesn't seem like science to me. That seems like marketing. That seems like, well, we have to tell everybody to get it to make sure that the right people get it. And I don't think that one size fits all philosophy works well. I don't think it works well for health. I had COVID. I'd had it twice. I had natural immunity. But let's also talk about the fact that what was the promise that was given to the American people and to people all across the world when these vaccines came out? You won't get it, right? And you won't spread it.
Melinda, do you mind if I'm so curious about a few of the things that you said. And
Yeah.
as I'm so grateful that you're here and that we're getting to have this conversation, because as a virologist, I share a lot of your frustrations about, people not being able to go sit on benches outside. A lot of us in public health were like, no, we're saying here are the risks, but then government agencies in different regions got to choose what they did. So public health
Right.
advised, but they weren't always being what was implemented. And that was frustrating, I think, for the public and for public health. And when you talk a little bit about this question of nuance for herd immunity, there are so many different layers, and it really depends on the virus too. And adding in the context of, the messaging should have been that it'll reduce your chances of infection, because there's no vaccine out there that prevents you from getting the virus. It's just not how our vaccines work. They give your immune system the tools to respond better so you won't be hospitalized or die. In the case of SARS-CoV-2, that was the real push, is that people who got vaccinated would reduce their chance of being in the hospital. Hospitals were being inundated in these big regions.
Mm-hmm.
But then further than that, the ability to reduce things like long COVID. And I don't know if you have any experience or thoughts on that aspect of this, but being able to reduce long-term symptoms after an acute viral infection, even if it's mild for you, some people end up with long-term symptoms. And then while you yourself are healthy, you're probably related to people who are at risk. And so how do you balance that kind of paradigm in your head? And how does that fit with this kind of dynamic
And
that you're talking
you
about?
do get immunity from having COVID.
Yes.
But it's temporary. It's
Correct.
short-lived. And I don't think anybody would advise anybody the best way to do this is to go get COVID,
Right.
because there's all kinds of dangers we knew at the time, especially if you're unvaccinated, of getting COVID. But her point, and I don't mean to speak for you, but you just said this, is the messaging comes out,
The messaging.
hey, get the vaccine, you won't get COVID. And then a couple of months later, the messaging has to shift because it just wasn't accurate. And now you have people dislodged from public health saying, wait a minute, you're changing the story. I don't trust this anymore.
Right.
Melinda, I think, we get the chance to talk to you, we get the chance to talk to public health officials. I think for them, turning this vaccine around in the short amount of time that they did was nothing short of a miracle.
Absolutely.
These things take years, and in this case, it took months. I think they are bewildered that 50 million Americans didn't opt to take the vaccine. And there's one estimate, again, I'm not a scientist, but there's one estimate that places the number of Americans who died unnecessarily because they didn't get the vaccine at 230,000. What you say, you didn't get the vaccine, right?
No.
And
My family did.
yeah. Can you just dig a little deeper into that and explain to us sort of what was going into your decision to not go ahead and take the vaccine?
Well, sure. I mean, it was, I totally understand about obviously putting other people at risk, and I would never do that. But I also know that it's a risk. Anything that you take is a risk. And for me, for my family, for other people that I know that feel the way that I do, taking something that is, I know you guys said, it was a miracle that they were able to produce it. And yes, it's as a society, the medical community, what we're able to produce is miraculous sometimes. But I also know that it was done very quickly. I also know that it was done with a new technology, mRNA technology. I mean, I listened to people like Dr. Brett Weinstein, who's an evolutionary biologist, and he was on, well, I don't want to name drop stuff, but he was on a program. And, he said, I've gotten every vaccine known to man, including rabies. He and his wife both have. And he goes, I wouldn't touch this. I wouldn't touch this vaccine. He said it's not a technology, the mRNA technology has not been been utilized in this way before. And so for me, I'm looking at several things. I'm looking at, my health in general. I'm looking at the fact that I've already had COVID, so I have some immunity, however long that lasts. I know that the second time that I got COVID or tested positive, I didn't even know I was sick. I had sniffles and thought, my daughter was a little paranoid about it, and I thought, okay, fine, for your sake, I'll test. And I tested, and I was like, oh, okay, I've got COVID. But I was fine. And I thought, well, there's my immune system. There's a memory, right? There's a memory of the response that it had to the last time I had COVID. And so my immune system kicked in, so I trusted that. But I also didn't want to put something into my body that hadn't been tested. I just didn't. And I know you can, they can claim that, these were the most tested, but it was rushed to development. And there's also a sense of, do I trust the pharmaceutical companies? And I'm sorry, but the answer is no, I do not. There's too much money involved. Pfizer made billions of dollars. Moderna,
let me follow up on something you just said that I find really interesting. You were listening to Dr. Brett Weinstein. When I say the names, Dr. Francis Collins, Dr. Anthony Fauci, Dr. Paul Offit, what's your reaction?
My reaction is that I am not sure that the people in our regulatory agencies really have health in mind. I think that our government is compromised. I think it's compromised in the FDA. Look at the ingredients in our foods. If we had government agencies that were really working for us, would we have high fructose corn syrup? Would we have red dye, blue dye? Would we have BHT? Would we have all of these things in our food? So, I hear those names, and I don't think doctor as much as I think bureaucrat.
In the pandemic, do you feel that that list of names, those folks were doing their best to save lives? Do you feel that they were compromised in their work in confronting this pandemic?
I don't want to say what people were trying to do, or I can't be in their heads.
Right.
I think that most people, at least I would hope, I would give them the benefit of the doubt that they are trying to help. I just think that the way in which they think they're helping may have had more, more dire consequences. I think that we haven't looked at, I had a friend who died after her COVID vaccines. She got a brain hemorrhage. She wasn't even 50 years old. And she hadn't been in an accident. She hadn't hit her head. There was no explanation for it. And, I've had a friend whose wife has had 2 strokes. She was fully vaccinated. I've had other friends who had weird rashes and headaches and lymph nodes that swelled. I pay attention to those things. And I think that part of the problem is that they may have thought this was the best way to do things. But again, I go back to, if we knew that people with low vitamin D were having worse outcomes, why weren't we doing something about that? Why is it that our first instinct is, let's create something that we can inject into people, versus saying to people, hey, you know what? We're in the middle of a pandemic. Go outside, go exercise, get vitamin D, eat a bunch of oranges, boost your immune system.
Melinda,
boost your health.
I completely agree that when, there's a threat to our system, we want to know that when data comes out, that action is taken and necessitated. And things like vitamin D, I think physicians were recommended to recommend that to their patients, but there's also a large population of the U.S. public who's vitamin D deficient in general. Mm-hmm. And I think we want to be really cautious about causation and correlation in this you've kind of really like struck me with some of the things that you've brought up. I'm so fascinated by this disconnect between what comes out in research and what happens in the public sector, and how we can better drive towards a solution. So one of that would be, during these times of crises, which government agency would be recommending supplements and from where. And we currently don't have a good system in the US, to my knowledge, for even supplements. They're outside the FDA's regulatory patterns.
Right.
And so for me, you know, therapeutics from pharmaceutical companies go through a lot more stringent examination than a lot of these other things that we might want to take to help supplement our immune response. And so I wonder what your thoughts are there. Like, what sort of solution do you see if H5N1 were to be a pandemic?
Bird flu, yeah.
Bird flu, right.
So, you know, it's interesting that you say about, and you're right. I mean, obviously a lot of supplements, you know, supplements are not regulated by the FDA, and certainly there have been some, you know, I know that there's been sometimes, I don't know, you know, heavy metal toxicity, or there's just been some problematic supplements out there. And, you know, it would be really good for us to be able to make sure that everything is as safe as possible. But, you know, you bring up about pharmaceuticals and, you know, all the regulation that they go through. But if that equates to safety, then why do we have things like Vioxx? Why do we have things like Fen-Phen? Why do we have so many drugs that are pulled off the market? And it's usually pulled off the market after so many people have been injured. And it usually starts with, you know, it's we have this sense of, I don't know, you know, is it the, you know, the fox being in charge of the hen house? You know, do we have enough regulations in our own agencies to really look at problematic pharmaceuticals? Or is it Pfizer and Moderna and Eli Lilly and all those companies that are saying, well, here's our findings, and the FDA greenlights? I mean, you know, you could speak to that more than I can, but from my standpoint, what I'm seeing is that I don't feel like our agencies are, I feel like they are too embedded with the pharmaceutical industry to be completely trustworthy. We need to divorce that, and we need really good, transparent science where it's not, you know, I mean, all of the stuff that when the COVID vaccines came out, you know, it's 90% effective. It's this, all of these things, as far as I could tell, were things that were coming from the pharmaceutical companies. Those pharmaceutical companies, you know, were telling the FDA and the CDC, and then in turn they were telling the media, and then the media was repeating it. But at the end of the day, you lost so much trust because, you know, as you said, when the story changed and people who had been getting the vaccine were still getting COVID, and some of them were getting really sick. They were still getting really sick. And there were some that were even dying. And so, you know, you have to look at that and say, well, wait a minute, I thought we were promised X. And, you know, as an individual, as a sort of, you know, the mom of the family, right? We tend to take on that role of, you know, watching things and trying to make sure that our family's safe. And I'm seeing this stuff and going, well, I don't feel like I made a bad decision here. And then when I see people with vaccine injuries, and yeah, I know you can say correlation, causation, everything else, but there have been an awful lot of people who've had issues. And again, those things have been tamped down too. And I feel like we're just not, we're not getting that transparency. And without that transparency, how can we have trust?
Melinda, I want to ask you just one final question. You know, we just got, you know, I saw a headline that there was the first death from bird flu.
Yeah.
I think with the man in Louisiana. Yeah. You know, bird flu, many scientists we're talking to believe it may turn out to be the next pandemic that this country faces. When you hear that, what do you think it would take for somebody like you, if it did end up being something bigger, human to human transmission, it ended up being a COVID-like situation, or if not even a COVID, just a pandemic in this country? What would your response be to that if the government were to say, like COVID, issue guidelines, that there were closures again, that there was a vaccine that was delivered quickly? Like, what do you think, how do you think you would respond?
Oh boy. That's my response. Oh boy. Another pandemic. That's kind of how I feel. Like, what's going on? What's going on? It's been 5 years and now this is just our thing. We just keep having pandemics, and I'm honestly starting to wonder. And again, I don't want to be a conspiracy theorist. I try really, really hard to arm myself with knowledge that is not, just from Joe Rogan or, whatever. But I have to trust my gut a little bit and say, really? Is this where we're at? Where, I don't remember having these kind of pandemics growing up. I'm 55 years old. I remember at one point there was a bird flu or something, and I think that they, it was like, I want to say in the 70s or something. Maybe one of you know about this, and there was a vaccine that came out, and they stopped giving it because it killed people. It was harming people more than it was helping people, and they pulled it back because a few people died. But I just kind of feel like, what is going on in our world that this is happening? Is it happening because is somebody messing with these viruses? Is this somehow some other gain of function thing? People do wonder about that, because it really seems like every time we turn around. And there's also a part of me that sees things like, remember when Zika virus was going to be it? And we're all just, oh my God. And, down in Florida, I have friends that live in Florida, and they were talking about, the fogging, the trucks, or I don't know where it was coming from, planes. They were fogging everything to kill all the mosquitoes. Of course, God only knows what's in that fog. But, I remember that, Zika was the big thing, and then it just went away. And so it's really hard to be just, an individual in this world and in this country and not kind of go, oh God, here we go again. Because it just feels like every other month, every other couple of months, there's something that they're telling us is going to be the next big thing, and it's going to be another pandemic, and you just go, oh geez, can we just live our lives? Like, can we just all just get healthier, and maybe we don't have to be so worried about all of this? That's one of the reasons. If you want to ask that, for me to punch that button for Donald Trump, it was because of Robert Kennedy, because Robert Kennedy's the only one who's talking about divorcing these regulatory agencies from the actual industries that they're supposed to be regulating.